If I go to a cardiologist, they might do a stress test, an echocardiogram, and an event monitor. They make sure I'm not an atrial fib. They make sure I don't have a pumping defect in my heart. Or an abnormal thickness of my heart. Like if I'm an athlete, we all hear about these horrible stories of kids that have sudden death on the playing field because they had an abnormal thickness of the septum of their heart and they didn't know it. So they do an echocardiogram, they check for that, they make me go on a treadmill. If I pass all of those with flying colors, then they say I'm good, no risk, you're fine, go on your merry way. But they miss the mild disease. It doesn't show up on those tests. So do I know what those tests are? Yes. And Anna, you give me too much credit. I'm not the innovator. I'm just the repeater of the story. I've learned a lot of what I've learned from giants whose shoulders I stand on in these fields, but they are often dentists. And the dentists aren't talking to the primary care doctors, and the primary care doctors aren't talking to the cardiologists, and the cardiologists aren't talking to the radiologists. So we're not all getting the same story. So what I'm good at is weaving those things together and making a story that makes sense.